Good morning, everybody. Welcome. Happy Wednesday. Nice to see everybody. See some familiar names and faces, other folks from email. Good morning, Heather. Hope I see Levon in the waiting room, Ashley. Some friends from Aurora. Good morning. And I see we have someone on the phone. Who do we have dialing in this morning? You might have to push *6 if you're on the phone.
This is Councilmember Eric Garcia from City of Thornton joining on my cell phone.
Oh, good morning. All righty. Well, welcome everybody. We're so excited to be on with you, even though it is virtual for this first meeting. So thank you all for making time. And I just want to recognize Kelly. I did get your message last night. Kelly from Adams County Public Health is going to have to jump off about an hour into our meeting for a meeting that she wasn't able to move, but we're so excited to have you here for the first half of our meeting. So thank you for being here. And I'd like it over to Commissioner Steve Odorizio for some welcoming remarks before we get started.
Hi, Jody. I hate to interrupt also, but I will have to step out for about 15 minutes at 5:30, and then I'll rejoin.
No problem. Thank you for letting us know. Commissioner.
Thank you. And thank you all for coming. I think this is an important first step in us trying to address the opioid and overdose problems that we have in our community. This settlement, as you know, is an opportunity for us to create some structure and some synergies. And while a lot of what we're talking about is the settlement and how to deal with money from one particular bucket, in this case, one of the lawsuits. But what we're really hoping to do here is establish a structure and a system that allows us to work together collectively to address these issues of overdose. And so I think I'm optimistic that while a lot of the discussion sometimes might be wrapped around some of the formalities of this particular settlement and this particular bucket of money, I really sincerely hope that we could just insert whatever input or whatever sorts of funds we might find in the future into this same structure, this group here, to address the issue of overdose and opioids and behavioral health issues. So I look forward to working with each and every one of you. I appreciate everyone being here, and look forward to us finding ways to try to turn the corner on this awful issue that we're facing in our community. Thank you very much.
Thank you, Commissioner. And I know we're still expecting a few more folks, but we are going to move forward in the interest of time. So Matt, if you can go to the next slide, we're going to do a check-in and do introductions in just a moment, but real quick before we do, some housekeeping. So thank you, everyone. If you're able to be on video, we would love to see your face. Just know that there are a lot of Rocky Mountain Partnership team members who are managing the chat box, recording this session, and synthesizing in real time. So we'll go around and do quick introductions for all of you in a moment. But I have on the line Matt Horn, Ben Nash, and Ashley Ettinger, kind of the behind the scenes magic for today. So thank you, team, for that. If you have any questions, you raise your hand, and then we just ask that you stay on mute unless you're speaking for the highest quality of sound. And we will be sending out to everyone on the call post-session synthesis with action commitments. So you will receive that, and we're also happy to share the slides from today. Next slide, please. So just a note that part of the MOU that everyone has signed, or the participating local governments have signed as part of this regional council effort across the state, is that all of these groups must follow the Colorado Sunshine Law. And so want to say out loud that these meetings are noticed and will continue to be on the Rocky Mountain Partnership website under our collective work addressing the opioid crisis page. So we'll send that out as well. We are recording these sessions and we'll post those on the website to serve as our minutes. And just a reminder, I know many of you are very familiar with this already, but just calling out that we really need public business may not happen out of the public eye in order to be in alignment with that. All right, next slide, Matt. So what will be accomplished today? Our primary session deliverable for this first meeting is to confirm the composition and structure of the Adams County Opioid Regional Council. Hopefully we can come up with a much more fun name than that. There'll be extra credit at the end if you have something clever to come up with. But our agenda is today as follows. We're going to do a check-in with some introductions and then start with the data, why we're here. We're going to look at the current state of the opioid crisis in Adams County, both some from a quantitative and qualitative standpoint, and then dig into what's been asked of this region. Heidi Williams from the AG's office should be joining us in a little bit to give kind of an orientation to this litigation settlement. And then we'll get into actually determining what the composition of this council will look like, both for voting members and the advisory committee, before we move on to closing and next steps. So we can go to the next slide. Oh, welcome everybody who's just hopping on. Good to see you. So some roles for today. I mentioned the Rocky Mountain Partnership team. We'll talk a little bit more about all of the functions of our role as we go, but we are convening and facilitating the session today. We have 6 initial voting members of the regional council who will be making official decisions, but we have a lot of contributors. There's a lot of stakeholders that we're so excited to have be part of the conversation and the decisions today. Several municipal leaders, local law enforcement, mental health. So thank you all for being here. Let's move into, before our check-in, just some norms for the session, and I'd love to open it up if there's anything that anybody feels is missing from this list, but to kind of set the stage before we dive in today. Really respecting each other's time by using it wisely, brevity, making sure that all voices are able to be heard and everyone's able to contribute in an efficient way. Really encourage this group to be vulnerable and courageous, lean into any discomfort. Hopefully this is not an uncomfortable meeting. I think it's pretty exciting and we're really excited to move forward. If there's anything that comes up that isn't really in alignment with the deliverables today, please use the virtual parking lot. That is, put anything in the chat if there's something that comes up that we need to get to. We'll make sure to capture those things so that if there's anything that pops up for you, that doesn't fall through the cracks. Assuming best intentions of everybody on the group. Excited for everyone to show up with an open mind and foster a space of active listening, keeping our session goals at the forefront of our mind. And we, as a backbone team, will be taking and tracking action commitments, who's going to be doing what by when. Is there anything that anybody would like to add to this list? We feel good about moving forward. All right, move forward 2 slides, Matt. All right, so I'm going to stop talking for a minute and do a check-in. Would love for everyone to share your name, the organization you are with, and the role you play there, what your role is in today's session, given those 3 different categories. And then if there's anything that wasn't outlined in that agenda that is top of mind for you today. So I'm going to go ahead and go on mute and let people popcorn in, but if I need to roll call through, I can also do that.
I'll start. Good morning, Glenn Robinson, Adams County Human Services. I'm one of the deputy directors here. My role, I oversee Head Start, the Workforce Business Center, the Veteran Services Office, and then also some legislative initiatives. Today's session, look, listen, and learn. Right now, I'm just trying to figure out the major priorities that we're wanting to uncover and figure out how I can contribute.
Thank you, Glenn. I'm going to kick it over to Levon because you're next on my screen.
Morning, everyone. Levon Hupfer. I'm the Director of Diversion, Health, and Legislation for the District Attorney's Office, Brian Mason's office, and really excited to be here. I'm a licensed addiction counselor. I've been an addiction counselor for 20 years, so really seen firsthand the effects of this crisis, and so really excited to be here with all of you and get this going. So thank you.
Levon, Councilmember Padilla.
Good morning. I'm Peter Padilla. I'm City Council representative to this group from Brighton, Colorado. Very excited to be here. And my role in today's session is mostly to learn, to understand, and then help to structure where we're going to go, what are we going to accomplish. So not a whole lot to say there, but I'm very excited to meet all of you.
Thank you. Kelly.
Good morning, everybody. I'm sorry I'm not on screen. I'm in transit. This is Kelly Weidenbach with Director of Public Health Transition at Adams County. I'm working to help develop the new Adams County Health Department. Today, I hope to just be listening and understanding what the role of that new health department has in this process, and helping to look at work that could be done with this funding to address risk and protective factors. So I'm excited to be here. Thank you.
Thank you. Heather.
Good morning. I'm Heather Geyer. I'm the city manager with the city of North Glen. And I'm here this morning to learn more about next steps and make sure that North Glen has the individuals in our organization that are most appropriate to be part of this team, possibly the advisory council, and looking forward to hearing what thoughts have been started in terms of use of funds and overall regional coordination. We definitely support a regional approach on this front. So thanks for having us.
Thank you, Heather. And I'll keep it in North Glen and hand it over to Chief May.
Good morning, everybody. Jim May, North Glen Police Department. Actually, I'm here today to actually just say and listen, learn, see what we can do as especially first responders in trying to get ahead of this dilemma in all our communities.
Thank you. All right, Kendall.
Good morning, everyone. I'm Kendall Kocha. I'm from the city of Aurora. I am the manager of the Office of Special Projects, which is kind of short for figuring stuff out. And so I have been asked to kind of help out with the regional councils on Arapahoe, Douglas, and hopefully Adams County as well. We're hoping that Aurora will be considered as one of the voting members on the council. We have a team of staff that would also love to help be part of the solution to the statewide and nationwide problem.
Thank you, Kendall. Go ahead. I think someone's unmuted. Please introduce yourself. Do we have any other Aurora team members on the call today?
Good morning. This is Kirsten Claspel, Budget Program Manager in Aurora, and I'm here with Kendall, and she captured it all.
Perfect. Council Member Garcia.
Hi, I'm Eric Garcia, council member, City of Thornton, Ward 1. Just here to listen, learn. I've been actively involved in the opioid crisis for about the past 7 years, specifically being in the trenches with my younger sister, who has been in active addiction for about the last 7 years. Just here to listen, learn, and see how we could help get through this crisis together and help those that are facing this disease.
Thank you for being here. And I'd love to pass it over to Judge Quick.
Hi, I'm Don Quick. I'm the chief judge for the state courts in Adams and Broomfield counties. I guess on the information side, I'm here to provide information concerning the huge increase of opioid use in the courts and use and abuse of opioids, and to learn what the community wants to do with it. Jody, I'm very excited that people are recognizing this just can't be a reactive sort of response to opioid use. We need to do prevention and education with concerted efforts as much as we do with the response. So thank you for inviting me.
Thank you for being here. I'm going to now hop over to Heidi.
Hi, everyone. Heidi Williams, Director of Opioid Response for the AG's office. And today I will be talking a lot because I'll be giving a presentation. So I will wait till then.
Gabe.
Good morning, everybody. Gabriel Rodriguez with Adams County. I'm in the county manager's office. I'm just here to make sure the process goes as smoothly as we can from the county's perspective.
Thank you, Gabe. And last but not least, Lysandra.
Hi, everyone. My name is Lysandra Gonzalez. I'm the Chief Executive Officer of the Rocky Mountain Partnership. Delighted to be here, excited to have our team here to support you through this process to ensure these dollars have the greatest impact that they're intended to have. So our team is here at your service.
I didn't get a chance to introduce myself. I'll go next. I'm Esther Clark. I'm the Director of Grant Strategy for Aurora Mental Health Center. Our CEO, Kelly Phillips Henry, couldn't join this morning, so I'm joining a little bit last minute as our representative, but here to listen and learn from the treatment provider perspective.
Thank you for being here, Esther. And I believe we have Tracy Ritter on the phone. Tracy, are you there?
Yes. Can you hear me, Jody?
We sure can. If you could just introduce yourself briefly, Tracy. I know we're going to have a lot of time with you later in the agenda. We're just doing quick rounds of introductions with your name and role.
Absolutely. And my apologies. My internet is not working on either one of my computers here at home. So my apologies for not being face-to-face with you all. That was not my intention. But I will.
Oh, we lost Tracy. We are going to hear more from her. She is a community member with lived experience and also wears a lot of different hats as an advocate and a co-chair of the Affected Friends and Family Work Group with the Colorado Consortium of Preventing Prescription Drug Abuse. So we'll give her a moment to hop back on. But while we do that, if we can just move forward in the agenda. Did I miss anybody else? Apologies. I was trying to go in order. Okay. We are going to talk first about data. Why are we here? Really understanding the importance of this issue. I don't think we need to convince anybody that this is an important issue, but it's always, I think, best to ground the conversation in those numbers. And so Colorado as a state has lost over 3,600 people to fatal opioid, prescription heroin, and or fentanyl overdose in the last 5 years, which includes over 400 Adams County community members. So roughly 70% of people who use heroin report that they start with prescribed opioids. And as of 2020, our state only had around 15 to 20% of the total capacity for treatment that we need. And I know Levon can probably talk a lot more about the statistics and the shortage of treatment around that, but it's just kind of a starting point. So I am actually going to ask Matt if I can share my screen and Ashley can drop a link. The part of the role of the Rocky Mountain Partnership is to pull together data so that all of you can really dive into it. And so in the chat, Ashley's going to drop a link. This is an interactive data dashboard that's live, publicly available on the Rocky Mountain Partnership website, but really is intended to be a tool for all of you to understand what the current state is, both from a numbers and voice and perspective perspective. And then also will be used to set targets and measure impact. Kind of what you were talking about, Heather, is what are these funds going to be used for, and how do we know if they're making an impact in real time? So we're not going to spend too much. There's a lot of information in this dashboard today, but a few things that we really wanted to draw your attention to. There's 11 tabs at the top of this dashboard. And I'm just realizing, here we go, current state data is where we want to start. So there's several metrics that our team has been working with other content experts around the state, the region, and even the country to capture here. And what you're able to see in here is trend over time on this first page. So what's been happening, and you can specifically look at what's happening in Adams County, we'll say, compared to the rest of the state, including what's projected to happen if nothing changes. So hopefully when this goes in the chat, you guys can also open it up on your own screens, but you can see as of right now, Adams County has lost 189 individuals to the opioid crisis just this year. And these numbers moving forward to 2024 are projections or forecast. So I'm going to pause for a minute. Does anybody have any questions? A few other data points for us to be aware of. We're also tracking emergency department visits that are opioid related, hospitalizations, and Narcan use. There's more data that is coming as our team is working really closely with CDPHE. And so if there's anything that anybody would like to see that you don't see included either right now or as you dig into this on your own time, please let us know, and our team can go and try and find that data if it's available, and make sure that it's here. The other thing that I'd love to draw your attention to is, in addition to showing trend over time, we're able to really look at that data through an equity lens. So what does it look like for different populations in Adams County by race, ethnicity, gender, and age? Awesome, and I see that that is in the chat. I'm going to go ahead and stop sharing my screen for just a moment so I can see everybody in here and pause for a second. Are there any thoughts or questions, Commissioner? I know that data is always something that you're really keen to make sure is front and center. And so if there's anything that you would like to call out or dig a little bit deeper into before we start our or go deeper into our conversation today.
I think everyone recognizes this is a major problem. The data just helps quantify it, but the qualitative losses you feel in your heart and what you see in our community and in our families. So thank you. The quantitative data, though, does help us for those folks who really need that extra bump of, some of us think in different terms. And so thank you for sharing that. And if we could just be clear at times, where we're getting the data and how to share it, that dashboard is supposed to be something for us to be able to share far and wide with as many folks as we need to. And what's indicated by all the folks that are here today, there's a lot of people dedicated to addressing this issue. So thank you.
Does anybody have any thoughts or questions about the numbers, data, anything that jump out of you as missing or that would be helpful? Yes, Leben?
Jody, did we dig into the number of treatment providers or resources for those affected by the opioid crisis? Because I think that, I don't remember if you're going to share that or not.
Yes, we did. And actually, we're going to dive into that map a little bit later, but our team has been mapping out who's doing work in Adams County to address the opioid crisis and what specifically are they doing. So that is included in the dashboard, but we'll kind of walk through that in just a few minutes. But good question.
Hey, Jody, is there any way to decouple fentanyl-laced drugs? Or is that already included in the data?
That's a really great question. And I'd love to pass that over to Ashley Edinger. Ashley from our backbone team really leads the data. Ashley, can you speak to the limitations around data and understanding fentanyl-laced drugs?
Yes, so the way that we're able to break it down based on how CDPHE collects it is actually on that main page of the dashboard. You are able to look at overdose deaths by fentanyl. That doesn't give us an idea of like how that fentanyl has come to be, but we do know that fentanyl was involved. That second page also of opioid overdose deaths allows you to look at the differences between different types of opioids and sources, and fentanyl is one that is called out as well. And so you can look at that by geographic region. You can select a specific opioid category up at the top if you just wanted to look at fentanyl. The other thing I'll just mention down below too is that we have created a great relationship with CDPHE where we're able to also look at data by quarter. And so we do have data for Q1 of 2022, which is why that looks so low on that graph is 24. That's only one quarter's worth of data. But that's where this second graph underneath it comes through as well. So you can look at that quarterly provisional data it comes in, knowing that that'll obviously continue to be updated and refined as we get confirmed numbers. But yes, that is something that you can drill down into.
Any other thoughts or questions? Like I mentioned, this is publicly available. We send it out in pre-session packet. We'll also make sure that this is sent out after the session. So as you have a chance to dig in, have your teams dig in, if there's any other clarifying questions or things that you think could help add to the value of this dashboard, please let us know. That's continuously a work in progress, and we want to make sure that it is the most useful tool for all of you. And so moving on, just a quick note, the role that the Rocky Mountain Partnership team plays in supporting this council to use data is not just looking at what the current state is. We do think that that is important, and we have to understand what the current state is, but also who is most impacted and what does that look like for different populations in Adams County. And we're going to hear from Tracy Ritter in a moment. Commissioner mentioned that it's just the numbers, there's also the faces behind those numbers. And so bringing that to life is also something that we're really proud of, that the voice and perspective is embedded into this dashboard as well. And perhaps most importantly, using all of this information to drive to action. And so as we compile all of this data and visualize it in a way that helps illuminate where the disparities exist, where the gaps exist, is using that as this regional council has the opportunity to determine what are those priorities for how these funds are going to be used. I know that's something Heather mentioned, that we don't know the answer to that yet. That's for this group to kind of look at the data and determine that we're actually setting targets and holding accountability to folks that are utilizing these funds to measure progress towards impact in real time, not just looking at it retroactively and say, did it work, but looking at it, is it working as those dollars are expended and as we embark on this work. So we'll go forward slides, please.
Jody, if I could just add, I think overarchingly, the key thing, the key role that we play, the Rocky Mountain Partnership Backbone Team, is to ensure that we're neutral to every organization or any organization's agenda, and really only not neutral to the results that we're trying to achieve. So we're here to support you all on to work collectively towards those things. So I think it's exciting to have a team like ours to be able to support you in that way.
And if I can add to it, when the county commissioners and the folks around the community that were involved in the negotiation with the Attorney General on how to distribute these funds, one of the goals of the county commissioners was to say, look, we may have certain county commissioners at any given time that are passionate about this issue. This happens to be me. And I can tell you now, all four of the others really do care about this issue. Hope to engage as many people as possible. But the role of the Rocky Mountain Partnership was to be that backbone operation so we can not have to deal with politics or turf wars or any of the things that just naturally happen in today's world of public policy. And so who knows, I may not even be here in a year, but we need to know that the backbone is still here, okay? That the backbone is still here and this effort is continuing. So it was very important for us to find a way. We believe that the collective impact approach is the right way to do this, to make sure that this effort is sustainable. This particular bucket of money, remember, we're not only just talking about this one bucket of money, but it's the start, is going to last for 18 years. So we need it to be sustainable and last through different politics, personalities, people, and problems. So as we go through this, our goal is to make sure that the ball continues to roll regardless of all those changes and challenges that we have. So I just wanted to put that in there so you understand why we asked for some help rather than us trying to do this in-house.
Thank you, Commissioner. And I had Matt just jump ahead for a few slides so that we can bring this to life a little bit more now. And if anybody has any thoughts or questions as we're going, please pop in. But like Lysandra and Commissioner D'Orazio mentioned, the role that the Rocky Mountain Partnership team plays is more than just facilitating meetings. That is a component of it. But we, as a comprehensive team, are developing and maintaining this data dashboard, as Levon alluded to, inventorying and mapping who's already doing work, what programs exist, where are there gaps within Adams County, and really helping this group to ensure that there's alignment with the statewide joint framework that Heidi's going to bring to life in just a moment. And really neutral to everything except the result is that this funding is awarded and invested in a way that has the most impact. And part of that also is going to be identifying other funding opportunities in addition to these settlement dollars. Commissioner mentioned that this is kind of the first wave of dollars. We expect more to come in, but there's other dollars that can also, we think, be applied to the infrastructure that's being built here to impact these numbers and abate the opioid crisis. So a lot of different hats and components, but really here to staff this group in any way that we can. So Matt, I'm going to have you bop back to where you were. And I believe we have Tracy was able to hop back on the call. Are you there, Tracy? You might have to dial *6. Oh, there you are.
I'm here. Hi, everybody. Thank you again for bearing with me here this morning. It's wonderful to be here. I was looking forward to being with you all this morning. And again, I think I'll just briefly introduce myself and then share a little bit of the work that I do here in the Denver area. So again, I'm the co-chair for the Affected Family and Friends Work Group through the Colorado Consortium for Prescription Drug Abuse. And I work as a family support specialist for Advocates for Recovery. And most importantly, what's brought me to this journey that I am on and brought me to the positions that I'm involved in is that I am an affected family member who is blessed to have been the mother to my beautiful boy, Evan Robert Ritter. And my story wouldn't be the same unless I shared him. So I always do that. And Evan's life, I will say, was well lived. And his presence in our lives had a far greater impact than his addiction. He was a young man, true to his word, someone who loved his family dearly. He loved music, writing, and reading. He was a talented athlete with diverse talent from football to swimming to lacrosse and snowboarding. It gives me a lot of comfort just in knowing that he always had a personal connection on his spiritual side, and his writings shared this with us after he left us. And Evan was the bond that kept our family strong, even when times were tough. He always had a way to bring laughter to the moment, and he had a soft, kind voice that drew people to him. I was always proud to introduce him to my friends and coworkers because he was always respectful, kind, and conversational. To his peers, he was a loyal friend, a leader, and someone they trusted. We lost Evan in October of 2018. He was just 25 years young. I think of Evan every day, different times throughout the day, and I realize that he is the one who gives me purpose in doing the work that I do to try to help other family members who are struggling with their loved one's addiction, and to also be there for people who have lost somebody through this disease of addiction. So that brings me to a little bit of the work through the consortium, being a co-chair for the Affected Family and Friends Work Group. We actually, a big piece of the work that we do or have done is the Beyond the Numbers videos. It's video storytelling that we've done, and you can see this on our Colorado Consortium website. And in addition, it gives me great pleasure knowing that Rocky Mountain Partnership also has this on their dashboard, which we're so appreciative of them sharing this also with you all. And the Beyond the Numbers has videos showing family members and friends, people that have been affected by a loved one's addiction, whether that person is still with us today or whether they're not. It shows a family story through video storytelling about what their life was like, the person that they were, and the disease and how it has affected them as family members. And you will see that I shared one of mine with you all, and I think Jody will be able to present that to you guys too here on the screen. We also do shorter teaser videos, as we call them, and those are displayed also. And those are shorter, about 30-second videos, if you will, just to draw your attention and to make that public effort in showing the impact that addiction has and how it affects each and every one of us. It doesn't matter where you come from, your demographics, where you live, your influence. in the community, it affects each and every one of us. We all know somebody that has been affected by substance use. And so that's a big part of what we do. We also provide a resource list that has lots of different resources for our affected family members, whether that's grief support or just general support for treatment providers and things along that line, a resource of different books that you can look through. So we're pretty proud of that resource list that we've developed on the Consortium Affected Family and Friends work group website. And those are the kinds of things that we do. We also partnership with Adams County, and the way that we are doing that is through the Adams County Drug Courts, and that is through the work that I do through Advocates for Recovery. So we have a presence with the Adams County Drug Court with our peer coaches, and we work there with Tasha and Jesse through that court. And we also, through, I'm jumping back and forth a little, the Affected Family and Friends work group, we do have people that attend our work group. In our most recent work group meeting attendance, we had somebody that represented the Adams County area as a member of our work group. And in addition to that, we do partner with Tri-County Public Health Department. We support their prevention partnership, provider education, and international overdose awareness events. So that's some of our community awareness with partnering with Adams County. My role as a family support specialist with AFR, Advocates for Recovery, I basically support families that come and see me, either individually they come in and see me, or I have group meetings. That could be a family support meeting that we hold once a month, or CRAFT, which is Community Reinforcement and Family Training. We do that every week. And that is where individuals can join us hybrid, so either by Zoom or in person, and really learn evidence-based skills on how to communicate better, how to improve your relationship with your loved one that is struggling with substance use. And so those are some of the programs that I am involved in currently. But again, you know, it all leads back to my purpose, and that is really to help others and share my story about my loss of my son through my lived experience, in the hope that by sharing and being a little bit vulnerable, it will help other people to get the help that they need for their loved ones seeking treatment. Thank you all.
Thank you, Tracy. And Tracy mentioned a video that she vulnerably has included as part of the Voices Behind the Numbers page. So we're going to share that now before we dig into the litigation settlement. Matt? Matt, I can't hear any sound. I think Matt's working on restarting the video.
Yeah, I'm working on it. Hold on. Let's see if we go just straight to YouTube.
Your yellow warrior shoebox sits on the dresser in our bedroom. The treasures it held for you are now treasures for me. Remember when you were little and we spent our days at the park, jumping on the trampoline, playing tennis, and buying Pokemon cards? I called you my little buddy. Later, when you and I went to choose your first tuxedo for your junior year prom, unlike your friends, you chose the white one. You were always your own person, respected by family and friends. At that moment, I believed you would live your life fully, work, travel, meet that special person, and become a father one day. I open the box and pull out greeting cards from family and friends, ticket stubs from Broncos and Nuggets games, and concerts you went to with friends at Red Rocks. Your cherished snowboarding passes. All of this represents the young man I knew. You were my everything. Other letters tell a different part of your story, a part you could only share in writing. Your struggles through most of your teens and 20s with addiction, isolation, despair, and deep regret over your substance use. You never intended to hurt me or any of us. Your letters are clear about that. You were grateful for the effort that Dad and I put into getting you into treatment. Treatment, recovery, relapse. Treatment, recovery, relapse. The way you described your substance use disorder was so clear. You wrote, "Once is too much, and 1,000,000 times is never enough." Your wisdom guides me in the work I am doing to try to help others. If you were here, you would be doing this work, Evan. In another letter you wrote, "Truth is, I know a hell of a lot more than many do about what drugs can do to your life. And maybe I can even educate others about the consequences, if they're open to listening." You would have had a tremendous impact on so many lives. I may only have my memories in this shoebox, but the words that fill it are a gift from you to me, Evan. I've gotten to know you in ways that would have been impossible without it. Each time I open it, I hear your voice.
Smile. Dad can be taller than me.
I will forever remember my beautiful boy and the love you left me.
Thank you. Tracy, I want to thank you for taking the time to be here today and just reiterate that one of the values that the Rocky Mountain Partnership has that we're really committed to making sure as part of the work of this group is always making sure that lived experience is included at the table and part of those conversations, and having perspectives shared like we have today. Tracy mentioned that these videos also live on the dashboard, but also going a step further and making sure that those with lived experience are also involved in actually co-developing the solutions that this group is going to be putting significant dollars towards. And so I think that as we go and talk about the role of the advisory committee and the role that lived experience can play there is something to keep in mind. There's lots of different perspectives and experiences. I think that there's room to be included there. So thank you, Tracy. If we were here, I feel like we would give you a round of applause, but I know we're on Zoom. So does anybody have any questions for Tracy?
This is Council Member Eric Garcia. I don't have any questions for Tracy, but I just wanted to thank her personally for the work that she does and the care that she gives for families that are going through this with a loved one. Personally, I've spent some time with Tracy and been a part of just chatting with her when I didn't have nobody else to turn to or go to, so I just want to personally thank Tracy for what she's doing. It works, it helps, and just to continue on in memory of your son. And again, just a big shout out for the work you do. Thank you.
Thank you, Eric. I really appreciate hearing that. And thank you for your comments also, Jody. And I think that, you know, a big part of it, and I appreciate those things you said, but is listening and just, you know, we don't always have the answers. That's the thing about addiction. There's no easy answer to it. And I find that when I'm talking to family members. But if you can sit with them, be with them, and know that you share their frustrations, their struggles, their fears, you know, then it's not an isolated feeling. They don't feel so alone. You know, at least you have that support. And we didn't have that kind of support when we were going through this. Before, we didn't reach out to enough people in the community that were like us. We weren't able to find that. So I think the more you can find like-minded people that are struggling with somebody's addiction, you know, you can come up with ideas together on what might work with the person that's affected by drug use. So, you know, it does help. And we can't solve somebody else's addiction. They have to be willing to seek help and to live a life and take that journey towards sobriety. So, you know, but we as family members can still take care of ourselves and learn better ways to communicate, but also keeping in mind, we have to live for other people in our life too. We have people in our life we need to show up for, so how are we taking care of ourselves? So that's what I've tried to learn too over the years, and I'm not perfect, but you know, it's a day-to-day thing. You know, being a family member living in recovery is kind of like being somebody that is in recovery from drug use. You know, it's a process and it's a journey, and there's grief and there's sadness. So we have to keep working at it. But thank you all.
I'm going to go to Levon and then Commissioner Odoricio with their hands up.
Thanks, Tracy. Thank you for sharing your story with us. It's very impactful. I want to put a plug in for whether it's now or later. I'd like for the group to consider basically a statement, a declaration about what addiction is. I work in law enforcement, and one of the problems, one of the main problems with the opioid crisis is that we don't really tend to agree on what addiction is. And in the medical and in the treatment world, I can tell you that we haven't debated this for 10 or 15 years. We know what this is. But I can also tell you from a treatment provider, I have a private practice that treats addiction. I work in law enforcement. There is a lot of disagreement about what this is. I think that for the voting members, it's really important for us to make a statement to the community based on medicine and science of what is this? What are we talking about? And I can tell you, in a 20-year career, we've gone all the way from you know, you have bad morals, bad genes, you're weak, you're a sinner, to this is a disease of choice that arrests, captures the free will, which is what we know addiction is. So whether that's now or later, Jody, I want to make sure that that's on the agenda at some point.
Yep, that's a fantastic call out, Levon. We'll make sure Ashley has captured that is prioritized. Thank you. Commissioner?
Thank you.
Ms. Ritter, thank you for taking the time and courage to stand up. It would have been might have been easier for you to go the other direction and run away from this situation. And it's clearly that you've leaned in for the benefit of others. So thank you.
Thank you so much for saying that. I really appreciate it.
All right. Well, we're going to move on in the agenda. Thank you again, Tracy. And I'd like now to introduce Heidi Williams, who I don't believe needs an introduction, but Heidi is going to be sharing kind of an orientation with us all now. Okay, we know that this is an issue that needs to be tackled. What's been asked of Adams County, specifically as it relates to this litigation? So if you can go to the next slide, Matt. There, as you all know, our Attorney General's office and local government leaders have unveiled a joint framework for distributing the over $400 million that's coming into the state of Colorado through these litigation settlements. Adams County is one of 19 regions, and this is the council that is coming together specifically to focus on this region. And so with that, I'd like to kick it over to Heidi to walk us through the litigation settlement.
Great, thanks, Jody. And thanks, Tracy, for sharing your story. It really does help us to, just keep in perspective what we're really doing here, and numbers can be less daunting. But when you hear people's personal story, I think that's what really helps us continue this work in a meaningful way. Next slide, please. So, Commissioner Odoricio kind of mentioned this. He was on the team of folks that helped negotiate the memorandum of understanding that everybody signed. We have all but about 20 very, very small municipalities that signed on to the MOU. So we have about 330 local governments throughout Colorado that signed on. And one of the reasons we were able to get to that point is that we said, we're going to put together some core principles as we negotiate, because it wasn't like everybody came together and everybody was happy. There was definitely tension. There were definitely things we needed to work through. So the first thing we said is, look, let's maximize our settlement funds. The only way we could do that with Johnson & Johnson and the 3 large drug distributors, who are the first ones that we settled with, the only way to do that was to get all of our local governments to sign on to this plan and release any current or future judgments or litigation against those defendants. So that's why it was so important for all of us to be working together. And we achieved that. So now we'll be getting the maximum amount of funds. Currently, that's about $380 million. We do have other lawsuits pending, so I do believe there will be more. The next thing was utilize existing infrastructure to the extent possible. So this just really goes to the fact that we're going to do our best not to duplicate services. We're all going to work together and make sure that what we're adding is really a value add. And then we're going to ensure equity for all local governments. And I'll talk about that in a little bit. Next slide. And also apologies to those of you who've already seen this, like, I don't know, 1 or 20 times, but I'll try to run through it quickly. We did that with a bunch of outreach. So the Attorney General and I did 18 town halls in 2021. The one on the left, this picture is a great picture because it shows us in Cortez, Colorado, Montezuma County, very, very conservative county. And we had 50 people there on July 3rd. It was the 4th of July weekend, and 50 people showed up. Lots of different political views, and nobody was there to talk politics. Everybody was there to try to figure out what we're going to do about the opioid crisis. So I just think this picture is so telling. We also did a ton of that on Zoom, and really reached so many people in that 12-month period. Next slide, please. So what we negotiated was this. 20% of the funds are going to go directly to local government. So every municipality and county has the ability to get some amount of dollars each year. And sorry, I didn't say this, but these settlement funds are coming in over 18 years. So municipalities and counties right now are deciding, are we going to keep the money that's allocated to us each year, or are we going to transfer that money over to the region? So as you can see, 60% goes into a regional opioid abatement fund. You all are Region 8, so you're going to receive, per the formula, 60% of the total settlement funds every year for 18 years. The reason why the 20% can be diverted is because obviously over 18 years, it does kind of water down the funds a little bit. And so some municipalities or counties just go, look, let's do this on a regional basis. Others might say, I'm getting enough money that we might be able to do this program, so we're going to go ahead and keep our dollars. So you all are working on that right now. 10% is going into an infrastructure fund. This is how we put this together to make sure that we do have equity for the local governments, especially those who have been really hard hit, but have a lower population, so won't be getting as much funding. And then 10% goes into our office for more statewide initiatives, the main example right now is we're getting ready to put out an RFP for a really big awareness campaign. So around fentanyl, around opioids. So that's really exciting to me. And we're really trying to find a vendor who can, who can demonstrate that this, is really going to work. We're really going to get to middle school and high schoolers and all of their parents and caregivers because this is so important. It's really life or death at this point. Next slide. So this is the way the map turned out. As Commissioner Odoricio will remember, our office came to the group and said, we would like to see 7 regions. And the local governments were like, yeah, no, we don't, we have geography issues on the Western slope, mountain passes, et cetera. The metro area said, we kind of want to be on our own, but we're willing to partner if it's necessary. So you can see that the map turned out to be 19 regions. It's actually working really well. Everybody's really well on their way to getting their plans together. So anyway, exciting times. Next slide. So there is a governance structure. You all are the Regional Opioid Abatement Council for Region 8. That's the middle one. Your responsibility is to put together a 2-year plan and to, administer those funds that come into your region, as well as you have to report the funds that you spend. We have the Abatement Council, Colorado Opioid Abatement Council. We call it COAC because we need another acronym in our life. We have 6 local government appointees, and that was put together by CCI and CML. And then the Attorney General also has appointees. The Attorney General appointees are experts in this field, as well as one affected person. And then the 10% share is overseen by this Opioid Crisis Recovery Funds Advisory Committee. That was put together in statute. As you can see, there are also a lot of experts on that. The reason we didn't use that is because there was only one, well, there were 2 local government people on that whole committee out of about 30 people. So we were like, yeah, that's not really going to work for our local governments, is to have non-local government people providing oversight. So that's why we added the Abatement Council. Next slide. So this slide on the left is the Attorney General signing the opioid MOU. And I will tell you that this was a really big deal, that we, number one, reached consensus on how to spend these funds, but also that almost all of our local governments signed on. We were the first state of our size to come up with this type of an agreement and that many signatures. And we're still leading the nation in a lot of this work. So we're very excited to work with all of you to continue to really lead the nation. The right picture I love, it's Commissioner Odoricio, Mayor Coleman, and AG Weiser, because I think it looks like what really works well in Colorado is that local control is what we really want, with state support as needed. So I just thought that picture really represented that. Next slide. So we're getting some frequently asked questions. The first one is people want to know, who do we contact if we want to get involved with Region 8? How do I get involved? How do I apply for funding? We're obviously getting a lot of requests right now for funding. And so we've been working with Jody and Lysandra and team to figure out like who's the best people to put you all in touch with, or to put your stakeholders in touch with. And this one is, a little more geared toward the municipalities, is just to make sure that you have some municipal representatives on your council. And then also make sure your meetings are noticed so your constituents can participate, those sorts of things. So if you can go to the next slide. These are just resources for you all. I'm assuming that RMP will be sending you the slide deck, but there's some principles for like best use. There's some other article from Harvard about harm reduction. And then there's lots of different ways that you can look at grading funding. So you've got your ARPA funds, there's grants from our office, we have the infrastructure fund. So there's a lot of different funding methods. So as you guys are working through your plan, if you have a gap in funding, just reach out to our office and we'll see if we can connect you to the right funding source to help you with that. There's a ton of money right now to work on this problem. And so we need to utilize all of that. Next slide, please. I won't go over all of these, but these are basically allowable uses. There's treatment and recovery. So medication assisted treatment, supportive housing, telehealth, the continuum of care is a really important model. And then gender specific care. Next slide. And then intervention, everything from, from the pediatrician's office, where they might, the doctor might screen a family and recognize that there might be an issue. So how do we, recognize that before the kids are taken away from the home and provide those good interventions? But it's also training for, the ER personnel who may get somebody in there in active overdose and they need to detox them. So there's a lot of ways that we can use intervention. Next slide. Criminal justice, this is a lot of like what the work Levon is doing. It's really putting funding into getting those folks who really need treatment rather than jail. It's also about the folks who do need to go to jail, that they also can get treatment while they're in jail. So you can use the funds for that sort of thing. Next slide. Prevention education. I mean, I talked about that a little bit. We'll be doing a pretty big campaign. I know there are some other regions that are talking about doing some small, anti-stigma campaigns or, other campaigns. But if you guys all, are talking about that, let me know, because we'd really rather you be able to spend your money on some actual services and let us kind of do the awareness. Not saying you guys can't do an awareness campaign, but just wanting to let you know that we're doing that. We also have a social media toolkit if anybody's interested in it. That's really an awareness campaign about fentanyl. Happy to provide that to your, your public information officers. And the other thing I would just mention is make sure that you're reaching out to your faith community and your nonprofit community. There's a lot of folks out there who are already doing this work and or want to do the work but don't have the funding. So that's another great place to really grab people to help. And everything I've read, all the research I've done, it's like community is really what makes this successful. So when you have buy-in from your community, it's going to work better. So next slide. And then harm reduction, this is anything from naloxone, syringe access. Harm reduction can be a little political, but what I like to say is, what's your comfort level in your community, and some of that anti-stigma really helps to bring harm reduction along. So anyway, that's just something that's allowable as a use. And next slide. And then there's others. So there's planning, there's trainings. Some people are like, let's put together some scholarships for folks so we can get more certified addiction specialists, or so that we can get more addiction medicine specialists. So there is money for training and that sort of thing. Next slide. So just a few next steps. We are hosting a conference on August 15th and 16th. If you are interested in coming to that, please let Jody know. She can get in touch with me and we can get you a reservation. That'll be here in Denver this year. And then next slide. We're also putting together a dashboard, but it's pretty different from the one you guys are doing. So it's not duplicative. We are putting together a dashboard so that folks can go in and see, what did your city get or what did your region get as far as funding? And then what did you spend the money on? So ours is more of a transparency dashboard. And, I'm pretty sure that, Jody and team will link that, from your dashboard site. So I'm really just trying to figure out how to work together on that. And then next steps, next slide. And then we're putting together toolkits. So we'll continue to provide resources and just be there to help you all as you're navigating this process. I currently have a standing appointment weekly with your team. I don't always make those meetings, but there's always access to my team, myself or my team. Next slide. And then the timeline is this. So you have until July 31st to opt out of or opt in to receiving your settlement funds for the local government. So that 20%. and I think Aurora knows this, they're on here. We haven't sent that opt-out out to you because you all are doing something a little different in Arapahoe County, but we'll get that out probably in the next week or two. You don't need to worry about that. Next one, the second payment will be made to the National Administrator on July 15th. So as of July 15th, the National Administrator, who is a bank, Becky's, that's holding all these funds so that it doesn't hit the general fund, all that money is going to be in by July 15th. This year you have two payments, so your available funds are about double what they will be on a normal basis. I just want to emphasize that. And you probably won't even be able to get funding until fourth quarter, just because you all still have to put together your 2-year plan, and then we have to approve that, and it just goes through this whole process. I think future years will be a much more seamless process. So your 2-year plan is due around September 15th. If you need more time, just get in touch with me. We're trying to work through some of that with the National Administrator now. And then there will be a chance for an amendment to your plan. So obviously, you might have this really great idea and then you find out you don't have the resources to make it work, or it's bad timing, you need to push that off. You can amend your plan this spring. So anyway, I think that's it. There might be a slide that shows the fentanyl toolkit. Yeah, so this is our toolkit. Again, if you want the toolkit, it provides you all of the information on how to roll out this awareness campaign. And then I think that's it. Yep.
Heidi, before she hopped off, Kelly had a question about that awareness campaign, about how it will be evaluated and will we know if it's effective?
Yeah, I mean, that's part of the RFP is, working with a vendor that has demonstrated, success in their campaigns. And I am not an expert on marketing or anything like that. So we'll be, bringing some other experts to the table as we're identifying and evaluating the RFP. So yeah, it's a great question. I'm really nervous about, making sure that we're getting that, that money out there for this campaign and that the campaign actually works. We do have Safe to Tell in our office. So they work directly in my department with me. And so we feel like it's a really good partnership that we'll be able to utilize some of the work that they're doing and some of their social media channels and stuff as well. So TBD on that, but yeah, we're very focused on making sure we do this right.
Thank you, Heidi. Does anybody have any other questions for Heidi about the settlement, the funds, logistics, any of that?
Specifically questions, I just to thank you again, Heidi, for sharing this. It's a tremendous amount of work, and I'm really impressed by how cleanly we're able to understand exactly what we have in front of us, how it came. So I appreciate the efforts going into that and your teaching us at the rudimentary level repeatedly, because it takes a few times for it to click for me. Thank you.
Yeah, I always feel bad, like, oh, I'm sorry you had to see this before, but then you're right. So it's really complex. This has been an amazing opportunity for me to see like how much goes into this, because we are responsible to the courts, right? So you all have to spend the money right, and we have to make sure we're watching that, because we're ultimately responsible for all of this money to the courts. And so it's been a really great experience. And of course, Adams County has a special place in my heart. So whatever I can do to help you all, I'm here, and my contact information is there. Most of you probably have my cell number. So let me know what you need from me.
Well, like Heidi said, she's working really closely with our team, and I feel like we're becoming very fast friends, very, very quick to reach out and respond. So if you have anything, also our team is happy to help find answers to those.
Thanks, guys.
All right, Heidi, I know you don't have the full time with us, so happy to have you on as long as we can have you. But if there's no other questions, we will move on along a little bit, we've already shared this slide, but just want to reiterate that part of the role of the Rocky Mountain Partnership team is actually mapping out who's already doing work and also those funding sources. So if you go to the next slide, Matt, this is where the chat is enabled. Everybody has access to it. We will work with Heidi directly to map out any funding opportunities that her office is aware of. But if anybody else has anything that we should be thinking about as potential funding sources for the opioid crisis, drop them in the chat so that we can make sure that we're including them, so that we can identify what those additional sources are. I'll let you put those in the chat and we'll move along, because I'm excited to share with you what's been mapped so far in terms of stakeholders. So Ashley was going to be putting a link to this interactive visual in the chat. I have some static images here to walk you through just a few things. This is really intended to show who is already doing work in or immediately outside of Adams County as it relates to the opioid crisis. You can go to the next slide, Matt. There's a few things to note. The way when you open up this map, they're organized is by what type of organization are they? Are they a direct service provider, et cetera? If you can go to the next slide, the function that they play is in the legend, and that's how they're color coded. I know it's kind of small to see on here, but it's very interactive when you open it up. You are able to really interact with this data and organize it in a way that makes sense. So if you go to the next slide, on the right-hand side, you'll see a filter that will allow you to group the information by different categories. And so feel free to play around in there. Go to the next slide, Matt. You can connect it by function instead of by the role that they, or the type of organization that they are, et cetera. So we're not going to spend too much time in this now, but we will, it's in the chat. We will also send it out in your pre-session or post-session packet. Rather, if there's any organizations on here that are missing or anything that's incorrect, just let me know directly. We will continue to update this map. Oh, and Matt's pulling it up so you can kind of see what it looks like when you open it. It's kind of Prezi-ish interactive. The next layer to this that our team is working on is actually more of a live database of what specific programs each of these providers or entities is providing. And so Ben from our team is working on building that out. It will be linked here and will be shared out with everybody on this call as soon as that is further fleshed out, so that we can continue to make sure that we have an up-to-date capturing of all of that information. Any thoughts or questions about this tool? Okay. So moving on to the final section of our agenda
Jody,
today.
I think it's important for I just want to reiterate that, guys, this is important because instead of just the existing organizations going out and grabbing and competing for this bucket of money, what we need to identify right now, as Heidi presented, like the 5 or 6 kind of areas or domains of potential services to address opioids, we also need to identify what doesn't exist. And if we just give the money to the folks that are already there, then we might miss opportunities to bring in or identify how to fill gaps, because people who are in those gaps, or meaning nobody's in those gaps, won't be able to ask for the money. So it's really important that we do this asset mapping, this asset inventory across Adams County. So we really need everyone's help in this. So I just wanted to put that out there, because that's how we're going to be able to identify our full assets and inventory of what we have across the spectrum of services.
That's a really good point, Commissioner. And this is a perfect start to that. So we need everyone's contribution here to identify who else is doing work, what else is happening.
Levon?
Thank you. I think part of it too is making sure that we differentiate. I just looked at the map really quickly. And for example, when you click on treatment, it gives options. However, there's some, I don't know, discrepancies or, for example, detox is not treatment. And so it shouldn't be listed under treatment. Furthermore, there's some agencies listed as recovery services. And I think even for me, who's in the field, I need to be really clear about who's providing licensed clinical care and who's not. For me, if we can make that distinction, that's going to really help because we need to make sure that we're understanding these are the agencies providing MAT. These are the agencies providing licensed clinical behavioral health care. These are the agencies providing recovery services, support services. And there's really those three buckets. So that's what I need to move forward.
That's perfect. And that's exactly the feedback that we need from you all as content experts on how to make this as helpful as possible. So we have note of that, Levon. We will make those changes. And I will also reach out to you offline. We'll kind of vet that as those updates are made to see if there's any further changes. And if anybody else has similar input, would be open to having digging into this or shooting an email over with some suggestions. I'm very happy to take those and implement those improvements. All right, you can go to the next slide, Matt. All right, so the composition of the regional council, there are voting members and an advisory committee kind of under the umbrella of regional council. So as of right now, and I know that we've sent this out before, but just to remind everybody, we have one voting member currently from each of the 6 stakeholder groups that are recommended through the Attorney General's office. Commissioner Steve Ludovicio from the county, Glenn Robinson from Human Services, Kelly, who had to hop off from Public Health, Levon from the District Attorney's Office representing law enforcement, Don Quick representing the courts, and Councilmember Peter Padilla from cities. I will also share that I had the opportunity to attend a conference last week for the region calling themselves GROC, which is Jeffco, Clear Creek, and I think Gilpin counties. And they have a very similar structure. So what our Recommend Partnership team is putting together kind of 2 options or recommendations for you all to reach consensus on what makes sense for this region. So if you can go to the next slide, Matt. And actually, can you go one more? I think there's a visual. Yep, this is going to be more helpful. So this is the first option for the regional council. And I think the advice that we've had just in talking with other content experts, with Heidi in the AG's office and other regions, is how do we start small and grow as needed, which has been what's been done so far. And there's already some opportunities that we'd like to propose today that could enhance this group. So what you see right now are those individuals that I've already mentioned, but wanting to consider adding in an additional seat for local law enforcement to join a representative from the District Attorney's Office, as those are both different and critical perspectives. And then also adding in an alternate. So for each voting member to also have an alternate that is present, not necessarily voting unless the voting member is unable to attend. And then we have kind of a second option, but before I move on to that, I want to stay on this local law enforcement representative seat for a moment and see if there's any thoughts, questions, things coming up for folks as we put forth that recommendation. Chief Mate?
Yeah, I think, again, I think for the law enforcement district attorney office does have a different perspective than I think, regular police or sheriff department. So I would love to see a law enforcement police representative or sheriff representative on that board. So I think that'd be very important.
I would agree.
Yeah, and we support that too. I think it was our idea. But I also have another question about, I think Heidi's got, oh no, Heidi's here. In general, are we bound to any sort of structure with the voting members, or is this, I guess what guidelines do we have in terms of the voting members? Because I think that when we start talking about prevention and intervention, which is really, at the forefront of this issue, having representatives, like a school representative or something like that might be really critical. And so I was just curious about, the structure.
the MOU has recommendations, but you all get to determine what the structure is. We tried to leave it to the local regions to, make the decision on what's best. In some of our regions, we have like 9 counties and they're small counties and they don't have people that can even attend. So we tried to just keep it as loose as possible. But, these are definitely the ones that were called out for voting members. And voting members have to be a local government employee or elected official. Whereas the advisory committee members can be, anyone who's engaged in the crisis. Hopefully that
Heidi,
helps.
am I correct in that part of that is because those folks may actually be applying for funds to do the treatment, prevention, or whatever work that is?
Yeah, it's not the first reason, but it is obviously something to think about with conflict of interest. The real reason is because we all as government officials are responsible for spending this money properly. And so that's why that was really the first reason why it came to be that way.
Commissioner?
I'll say that the division between the governmental official agency representation as voting versus some of the nonprofits, other jurisdictions throughout the course of our negotiations and discussions were very clear that in some jurisdictions, the nonprofits, they were afraid would have, since they were being funded, would have undue influence if they were also able to vote on their own funding. But also because the buck stops with us, government folks, that's another reason. So I would also appreciate the fact that we also make sure, because we know that once we get a lot of, and it's no offense to the nonprofits, I get it. Your job is to go out and get as many resources as possible. So please don't take offense to this, anyone. But the nonprofits will be competing heavily for that, what's in that bucket of money. And so that's why I pump the brakes on 2 things, or ask us to, is on making sure when we do our asset inventory, we take into account people who are not at the table, the services that are not being offered. And then number 2, to make sure that we also have some checks and balances to make sure that we as a group are okay with where the money's going and not have that unduly influence. In some jurisdictions, not ours, you may have like one hospital that is extremely influential. And that may be good for that jurisdiction, but some of those other jurisdictions said it was not. There was a conflict of interest. The one question I do have for the folks in the city county representation would be, if you guys want, I know Jody, you're going to probably talk about another alternative for expanded city and county representation. The goal here, no matter what we all choose, is just to make it as inclusive as possible, so we can expand the number of people who are passionate about addressing these issues.
And I'd like to get to Kendall, but also Matt, can you go to the next slide with that? Because I have a feeling, Kendall, this might be what you're asking about. Is another recommendation of actually having 2 municipalities represented or 2 cities represented as voting members. And if that is something that this group decides, a recommendation would actually be to balance it out and have 2 representatives from the county as well. So I'll pass it over to you, Kendall, and see if this is in alignment with what you were thinking.
This is exactly what I was thinking. And when it says rotating city, I wasn't sure if you said when you're talking about 2 representatives from 2 different cities, would that be at the same time and then 2 others rotating in at a different time? Is that what you're referring to?
Yeah, and in talking with the GROC region and how they're handling it, again, they have 3 counties, so their makeup is a little bit different because they're not just a single county region. But this would be 2 voting members with 2 non-voting member alternates from cities, however you all decide to put those representatives forward. We would recommend that all of these seats have 2-year terms, but not impose a limit unless that specific stakeholder group would like to do so. An example of this is public health versus cities. It's very likely that we're not going to want to see as much rotation with the public health representative as the cities might like to see with those voting members, if that makes sense.
It does. And then I guess just a follow-up question, if we're bringing in 2 representatives for 2 different rotating cities, I guess that how do they get determined with this group? And the only reason I'm asking is we do have several council members that are just the past couple of council meetings that we've had are very excited and willing to be on this team. So as voting members, and so I'm kind of here to kind of represent that as well.
Commissioner Mauricio, I'll pass it over to you, and then Council Member Padilla, if that is okay. And then just from what I heard from the other regions, the county commissioners actually designated those city representatives in that region. I don't know that that actually makes sense for the Adams County region, but that's how it was happening over there. So, Commissioner?
I'll give you my opinion on that last part. I would say let the cities choose who the cities want to do, and you guys caucus on your own and figure it out. And then we have something in our bylaws that says if they haven't made a decision by a certain time, then it gets kicked over either to this body or to the county commission. I don't care, but I think I don't want to get into who choosing which police chief and which police department. I don't want to get into which city. Let the cities choose, let the police chiefs choose, let them hammer it out. And then you don't want to keep. And so that's my recommendation on that piece. The other part is, you know, in DRCOG and in NADA, the alternates are pretty active. So even if we went with the first model where you have one city, one alternative, one county, one alternative, you still have that's 4 people. And what I would recommend, because we're also being pretty inclusive with the non-voting members, that this is more like a round table like NADA. I don't know who's on the, some of you know NADA, and some of you know DRCOG, and some of you know ADCOG. We're trying to be inclusive. We don't say, oh, you're an alternate, you need to sit in the back of the room. I think that it's actually better to expand the involvement as much as we can. What that does is it also creates some checks and balances. It brings more perspectives, but it also creates continuity, because we know that in the current political environment, things change quite a bit within your organizations a lot. So my only thing that we're careful about is having 4 commissioners potentially active on something when we need 3 for, you know, majority vote. So we prefer that first model with 1 commissioner, 1 alternate. But if the cities really want to go the other way, I bet the commissioners would be okay with having 2 commissioners plus 2 alternates. And then let's also remember, this doesn't mean we could include the cities and the counties could appoint staff instead of the electeds to those spots. And that might be something you say that you don't want to be tied to that. I always recommend flexibility in bylaws, but you might say, look, as a matter of course, we're going to have 1 elected, 1 staff, and you can figure it out within your caucus.
The other thing I just want to plug, and then Council Member Padilla, I'm going to shoot it over to you, is that any city, county representative, staff elected is always welcome also in the advisory committee to be engaged regardless of whether they're currently voting. And I know that's not necessarily the question that you're raising, Kendall, but there is always room for as many folks as possible to be included on the regional council in that way. Peter?
Yep, so the first thing is, as much as I adore all 5 of our county commissioners, I would not recommend putting a second county commissioner on this. First, we have enough places for the county commissioners to be, and enough places that they need to do that it's a pretty significant demand to ask this of multiples. And I really, really would advise against 2 county commissioners and 2 alternate county commissioners. 1 and an alternate is plenty. However, I would advocate for at least 2 representatives from cities, and potentially if this was to get to an odd number, you could balance that and have a 3rd local representative. But I would also recommend that those city representatives be elected officials, and we ask for staff to attend or to be engaged, but not necessarily to sit in the voting positions on this. As Commissioner Mauricio mentioned, accountability is here for those of us on the county and the city level to represent the constituencies who sent us. So I would advocate that staff from cities be appreciated and be part of the effort, but not necessarily be voting members of the commission. I certainly think we need more than 1 city. That if Adams County is the definition of the region, we are of at least 3 distinct definitions and sets of needs. Those things happening in Thornton, happening in Commerce City, happening in Aurora are different from those things happening in Byers and Bennett. And Brighton is just a weird balance at the edge of some sets of identity and the beginning of some others. So sorry, that was a long sentence to say we don't need 4 county commissioners engaged in this, but I would love to see the increase in the city representatives.
I will tell you that the county commissioners will want to make sure that there's a balance between the county representation and the city representation because of if you look at the actual funding structure, there's going to be $500,000 coming from the county decision or from the county and less than 200, about 200,000 coming from the rest. So whatever it does, I can tell you that the commissioners will want to just make it balanced. So if it's going to be 2 voting, that's what they'll be asking for, Peter.
Well, then the other 9 people on this may have to have a no, I get that. There's nobody who wants to deny that short, but then I would pull out the alternates in that one because we certainly don't need 4 attending.
I agree. Heather's got her hand up.
Yep, go ahead, Heather.
I agree with the comments by Commissioner Odoricio and Councilmember Padilla. I think there does need to be an increase in city representation. What that looks like, I don't know, but to Commissioner Odoricio's point, when you throw out that there needs to be a balance, I think we need to spend some more time around this topic. My thinking was, well, 3 makes sense at the city level, but how do you figure that out based on size of city? We've got part of Westminster, we've got Thornton, we've got Commerce City, we've got part of Aurora, and then you've got Bennett and those smaller. So then that leads me to think, well, do we just have a city representative from every community, whether that be an elected official or a designated staff member? With that said, I do acknowledge Councilmember Padilla's comments about having elected officials serve. So I think we need to spend some more time around what does this look like to get that right formula. I do feel strongly that there needs to be greater city representation, and I don't know, Commissioner Odoricio, if you think it's a convening of the mayors to get their perspective on, is it okay if it's 3, if it's 2 to represent cities, or maybe it's 4 or 5. I don't know what that right formula is, but I think that engagement needs to take place. So that way we're able to really set this group up for success and it doesn't become, wonky, for lack of a better way to refer to political in the future. And then there's that ownership and buy-in, given that there's significant funding tied to this, this work that we're going to be doing. So I think we need to do some type of touch point convening with mayors, but open to suggestions on what that might look like.
And naming some of our city folks, myself and Kendall in particular, reaching out to some of the other cities to find out how we can best represent their interests and make sure that each of the cities have a voice in this, because we're obviously not here to represent specifically Brighton and Aurora, but to represent municipal interest across the board. So it may be incumbent on us to do some reach out for that.
Levon, you have your hand up.
Yeah, I just wanted to make sure I was clear on the alternates. The alternates are simply alternates for voting structure, right? So it's not as if there will be, in this model, there will be 4 county commissioners. It just means that there's that there is an official record of who's voting. That's my experience in other boards and commissions. So I just wanted to make sure that that I'm understanding that correctly. And also, Heather, I definitely hear what you're saying. I don't know that we have time to do convenings and meetings. I think that from my perspective, it's similar to what Peter said. My job is to represent law enforcement. And so my intention is to reach out to all of the chiefs, and I certainly support adding another law enforcement rep. in addition to the DA's office, but my role is to represent all law enforcement and not just the DA's office. But my concern is that I don't know that we have time to not leave today and not have a decision. And I'll be quiet, but in that vein, I'm ready to make a motion. So
I'd like to kick it over to Commissioner and then Heather.
What I'm wondering is if there's a way, you're right. First of all, when we say the structure, the alternates don't vote. I am actually hoping that voting never really is an issue. Just let's be honest, team. In Adams County's goal is to try to be just like the judge, quick. And I know you had your hand up at a minute ago, Don, Judge Quick. But I'm hoping that we're going to be addressing region. Our concern always as a county is how to also avoid there being parochial battles between what may need to happen in Aurora versus North Westminster, and Northland versus what happens in Eastern Adams County. What we might do is identify and say, maybe we say that you could look at it different angles and say, we want one representative from a city or town that's population from X to Y, or you could break it out by geography. The reason why we wanted the balance of Adams County with whatever cities or towns are is so we don't get into those battles, because you're gonna have, but also, like I said, we shouldn't have a whole lot of fights on voting, we're hoping, but we also have to, opportunities to not just create regional opportunities within Adams County's region, but there's nothing to say that Kendall can't be kind of a linchpin over on her end of this, and we do something with Arapahoe in middle of Aurora, or that we can't work with Jeffco and do something in North Westminster that also serves Northglenn and Thornton. So like our goal is to create that balance, but also, if Heather's kind of right, there's different constituencies even within that one caucus of town cities. So Heather, go ahead.
Thanks, Commissioner Odoricio. I feel strongly that we need to make the time to get this right. We have a very diverse county, and how we utilize this funding moving forward and the natural synergies that are going to occur as a result of the collaboration between those on the voting council and then the advisory council. I think we really need to work through what our intention is behind these groups. I feel strongly that there should be more representation at the city level, whether it's an elected official, whether it's a city manager, or it's a chief of police. As a municipality, and this is no disrespect to anyone else on this call, our work is very boots on the ground. The work that we're doing in having stood up our crisis response unit here in Northglenn, I mean, there's so many natural touch points that are going to occur. We need to make sure cities have a seat at the table. So if it's Chief May for Northglenn, he's going to be that touch point to come back to our city council, our mayor, myself, and say, here's what's happening. Here's the opportunity we have to do something different or to move things forward. This representation model as presented, I feel strongly does not represent Adams County and the best that we can put forward. So I think we need to make the time to do some type of convening and really figure out what could we do more on the city side of things. Because I think when you look at all the other initiatives we've put forth and collaborated on, this feels different to me. I don't think this is hitting the mark.
I want to also make room if there's additional thoughts here. What I am hearing consensus on is that they're adding in the local law enforcement seat in addition to the DA's office has large consensus. Can I see just a show of like thumbs up, sideways if you're unsure, or down if you're opposed? And just kind of like a group temperature on the local law enforcement seat, regardless of any of the others. Lots of thumbs up. Okay. No sideways or down. Okay, so that is something that we can agree to moving forward. Commissioner Odoricio, I see you have your hand raised.
So Heather, do you think like the expanded representation to make it more inclusive or more representative of all the different cities of the county, do you think it would be better to look at it from the aspect of geography or size of community? What are some of your thoughts on the factors? And then also, the other issue is going to come up is, should people be a voting member if they didn't contribute their city or town's money to the pot, right? Like that might come up too. And so then the cities may say, well, we want the people who, to be voting members if they contributed to the regional pot. So that's a separate issue, but like, do you think that the geography or size, or is there another factor or characteristic that you think would be good to help expand the representation?
Well, I think we need to come up with the why behind. So whether it's geography or population size, I mean, if I were to leave this meeting today and go back to my elected body and say, here's what we're doing and here's why, it still just doesn't feel right to me, because I don't think we've had this convening. And then there's a large portion of our stakeholders that's not at the table. So I can't speak for my council members and my mayor. I invited them. They had, meeting conflicts. So I think there's voices that aren't at the table that I think we need to take a next step and hear from and get their perspective. And maybe through that process, we can get clarity on, is it population driven? I do want to say there's a nuanced piece here. I was sent an email because I'm the representative for our city for the funding piece. Northland wants to be a regional player, but I opted into receiving the funds and not having them go to the regional body because we don't have all this stuff figured out. So there's that other piece that the way I had my perspective on that was, we're going to figure out all the regional stuff, and then Northland's going to funnel our funding to the regional group. But I also need to ensure that the work of the regional group is going to represent Northland interests. So there's that piece of it too, because if at some point, I hope it never happens, but the regional group is not representing Northland interests, then we're going to want to figure something else out, right? So I think, there's just, I think we need to spend some time, and I know there's a sense of urgency to a degree, but this is too important of work to not, pace. We need to pace ourselves.
Don, you have your hand up first.
Yeah, I was just going to say that there's always going to be these representation issues. And when we put together the youth initiative, which was the precursor to the Rocky Mountain Partnership, we did a lot of outreach with a monthly report or a quarterly report so that that particular chief or city council person or someone that's not on a city council, we send it to some city that council members there that doesn't have somebody on, as to what direction the initiative is going to. So I think once we settle on some representation, I think it's just as important for the council to get out periodic reports so that all the cities and all the different police agencies and other people that are being representative know directly what's going on and feel they can provide direct input. So however this works out, you're always going to have people that feel like they're left out no matter how big you make it. And so to get buy-in, I think the communication from this council to the individual members of the city council and other organizations is a key to them feeling like they're part of it.
Kendall? Oh, Kendall.
Yeah, I was just going to say, I do agree with Heather to the point of where, we need to probably spend a little time, and maybe that is just now. But I think with Arapahoe County and Douglas, I believe the same thing. They picked out, the two larger cities, the two larger towns as being the permanent seats, and then the eastern and western slopes. What they did was they had those towns rotating in, and it ended up being just fine with all of those groups. So that might be a way to look at this, would be to figure out, your two larger cities, towns, and then have your smaller areas rotating in. So that might be an option to kind of help with that. But I do agree, if I going back to our elected officials, I would love to have something a little more solid and a little more not broad, but more people represented in these models.
Councilmember Padilla.
So I think that where I would stand, although I have not seen what the district attorney's, two county commissioners, one elected mayor, one city manager. Okay, so I guess I would not support the proposed motion with a mayor and a city manager. I guess I would recommend increasing the city representation to the 2, and then making it part of my responsibility as the first one asked to sit on this, to go and find that proper representation and figure out what the city conversation leading into this council is. I think that we need to increase that membership, but I think that we then need to go in and figure out how to obtain that representation and seek the right participation.
Sandra?
Along the lines of what Peter was saying, my recommendation, again, from a neutral backbone standpoint to the group, is that this group make a decision today to increase the city representation by 1. And then the action commitment would be that we would convene city representation to make the determination on the criteria for how those particular seats are identified and go from there. But at least then we have some constructs so that we don't open up a can of worms. We know that this structure works, and we also know that it's working in other places, and it's a good way to move forward from my point of view.
Commissioner Doricio.
Yeah, do we have can we show the expected breakdown of the opioid settlement again?
Are you by municipality?
Yeah, I think we had that, didn't we?
I can pull it up if you give me just 30 seconds. Yes.
Sure. I support expanding the elected city representation. I was just telling you, and to be honest with you, Peter, I was saying, when I say 4 commissioners, not all 4 are going to show up. I'll be lucky to have the 2 there. And it's just alternates to make sure that we have the votes there. But I will tell you that because of the breakdown, my team will just say, look, just make sure that we have the same representation of the cities, to make sure that there is none of that parochial going on regionally or size wise. Because I can tell you now, I'm going to give a lot of credit here to North Glen. They're doing a whole lot of stuff for us, and they're not one of our biggest cities, right? And they're doing some amazing things. Now, you all are, but I'm just saying, like, when it comes to some of these other issues, like, I could see why Heather's, and I honestly agree 100%, Heather, don't give up the money and say you're going to contribute to the pot unless you know it's going to go towards something, because if it's not going and serving North Glen from the regional area, then you might need that money. So I totally get what you're saying. So but this is
my only note on multiple commissioners participating is that I sit on other regional councils, and as soon as 2 commissioners enter the room, the oxygen is taken by the 2 commissioners in the room. So I'm very cognizant of making sure that nobody else is chilled by that participation.
I think that's a personal professional thing that we may need to sit down and talk to those, and I might be one of the problems, and I'm sorry, Peter.
It's okay.
Commissioner, is this what you were hoping to see with the breakdowns?
Yeah. So that's the breakdown, and that's why our team is going to ask to have it be balanced the way that we're asking. But I think if we can break it down where you either have region or size, maybe that would be a way to expand the, to make sure that to fairly look at it from a regional level.
I was going to say, Jody, I certainly appreciate the commissioner's sense of camaraderie and consensus, but this is a topic that really hits home for a lot of us. And I'm on some amazingly cordial and consensus-driven boards, and we've always had to vote. I think that we're going to have to vote at some point on these matters. Whether I agree, we should try to drive consensus and get consensus for sure. But again, you know, we're dealing with lives, as we heard earlier from Tracy. We're not dealing with widgets and cars, and you know, we're dealing with the hearts and lives of people. But along those lines, hearing what Chief May and what Heather and what Steve had said, I want to make a formal motion because I think it's important. Again, I appreciate consensus, but I also want to drive the work forward because in my mind, just so you know, my heart, you know, I have struggled with addiction in our family for 50 years. And you know, have lost a grandparent, and my life's mission is serving people with addiction problems. So but I have heard what people say. I want to make a formal motion though, and I know we're not going to structure anything until next week or next time we meet, but I want to make a formal motion that we have that we increase the voting members to include one additional law enforcement representative and to include one additional Board of County Commissioner representative and one additional city rep. So that would be one judge, one DA, one law enforcement rep, two county commissioner reps, one human services rep, two city reps, and one public health rep for a total of 9 reps and 2-year terms. So that's my motion.
Second that motion.
As well as, sorry, Peter, as well as approving the alternates as Jody suggested.
Seconded as amended.
All in favor of that motion? Commissioner, are you talking? Sorry.
Yeah, I guess the point is because until we have a chair, is there anyone opposed to that? Then I think we move forward, and then each constituent group is responsible for filling your seats. And then we'll put, Jody, you guys are drafting the bylaws, and then what we'll do is talk about what happens in those unlikely situations where we need to have other people fill if that constituent group doesn't fill that seat. Does that sound good, team? Maybe it comes back to this point.
Our team is working with the Adams County Attorney's Office on draft bylaws and IGA based on what we've received from the AG's office and what other regions are doing. So we can amend those based on the conversation today and also share that out with all of the stakeholders to review and sign. I see a green box. Chief Quick, is that a yes vote?
Yes.
All right. Matt, can you move forward in the slides? So the advisory committee, those non-voting members that are also critical, the stakeholders that the AG's office recommend be included, not exclusive, or this is not an exhaustive list, but healthcare providers, recovery and treatment, additional city and county representation, someone from the AG's office, community members with lived experience, harm reduction experts, and others determined necessary. You can go to the next slide. What we have started to put together is a list of folks, and I apologize, I know it's kind of small trying to fit everyone on here, are folks or entities that have either expressed interest in participating in this capacity or have been recommended. I know that Kelly had shared over some of these as folks that she would recommend be included. And so I wanted to put this also forward to the group today. and see if there's anyone else that you all would like to identify. And I'll pause for a second. Heather.
Can you add Jessica Holst, our crisis response unit program manager, please?
Yep, Ashley's capturing that in the chat. Thank you. And any other entity or individuals? I see some that are coming in the chat just to me. So we will add in Life Recovery Center as a behavioral health provider as well. And unless anyone feels strongly about making that connection, the Rocky Mountain Partnership team will be reaching out directly. And one of the stakeholders that has been lifted are school districts. And I see Councilmember Padilla actually recommending 27J potentially. I think that having school representation is definitely something that other regions are doing. And so this could be, however you all think makes the most sense. It could be an invitation to several school districts that are within Adams County and see who's interested in participating on the advisory committee. Does anybody have strong feelings about what school districts? I will also just say I'm speaking with leaders within a lot of our local school districts. They are either passing board or superintendent policies around administering Narcan in schools. So this is something that is top of mind for many of them.
A question, does that mean we have is that a motion or is just up for discussion?
I guess I'm just asking a question, and instead of just one school district, should we be reaching out to all the school districts that are within the Adams County region to invite them to participate? Because there's different student populations, different issues that they're yes, please. Okay. So all the school districts within Adams County, see thumbs up from that. And then also I know, Levon, you volunteered to share other options of folks that are struggling with addiction or have lived experience. So we would absolutely like to reach out to those individuals. Tracy Ritter has invited the Rocky Mountain Partnership team and anybody from this council, if you're interested in attending a virtual meeting for the Affected Friends and Family Work Group, to share that. If there's any Adams County folks there, would also extend an invitation for them to also participate. Okay. If you think of anybody or any organization as we go, send them over to me via email. This is not have to be, I think there's a lot more flexibility with the advisory committee to loop in individuals and entities as we think of them if they're not already on our list.
Yes, and Jody, if I just add here, this is Tracy, add that that is a big part of what we do through the Affected Family and Friends Work Group is invite for the monthly meeting speakers to come in. And we've had Voices for Awareness, is Andrea Thomas, who is the founder for this big, huge campaign on fentanyl awareness and Fentanyl Awareness Day, which will be August 21st as a national holiday coming up. And I'm very happy to announce, meant to do this earlier, that Jody will be our speaker for our July Affected Family and Friends Work Group. So we're looking forward to having Jody speak on Rocky Mountain Partnership at that. Thank you.
And I'll use this as an opportunity to extend that invitation to anybody interested in this group that's available, interested in representing this committee. Happy to have you join during that call and be able to speak on this group's behalf. So you can message me separately if that's something that you're interested in doing.
Absolutely.
Matt, can you go to the next slide? I know we have just about 1 minute left, so a few next steps, and I know we've skipped ahead a bunch, so I'm going to read some things off that aren't on this slide, but we will be reaching out to all of the stakeholders to invite them to participate as advisory committee members. The Rocky Mountain Partnership team will also be making edits to the bylaws and IGA, coordinating with the Adams County Attorney's Office to make sure that that looks good before circulating it to all of you to look at. The motion has been adopted to add in local law enforcement, an additional county commissioner, an additional city representative, and alternates for each of those spots. The commitment is that each of those stakeholder groups will work together to figure out what that representation will look like, and that the Rocky Mountain Partnership team can I just confirm, is there a need for the Rocky Mountain Partnership team to also convene cities? Or is that something, Councilmember Padilla, that you are leading the conversation with Heather and other municipal leaders?
I'm happy to take responsibility and join in the effort, but I'm also very happy to have staff support in getting there. So
yes,
combination of the two.
Heather,
Perfect.
if that works for the both of you, we'll take the lead and just handle how we proceed in convening them and getting that consensus on representation.
Sounds fantastic. Thanks.
Perfect.
That's great. And that way we can also make sure that we're following the open meetings law and that there's no ambiguity there. So happy to help there. So I'll connect with both of you on the line.
Thank you.
Okay. All right. We are at time, so I will send some of this information in a post-meeting packet. But as everyone, I'd love to do a checkout, Matt, if you can go forward a few slides. We will send out the timeline of this work, how it is slated to go and make personal touch points. If there's any questions, then come up. But really love to hear from everybody out loud or even in the chat. One thing that you're most looking forward to with this effort, and extra credit if you have a recommendation on a name for what this Adams County Regional Council might be referred to. And that's a good question, Levon. We do not have a next meeting time yet. If there is a motion for a date, I would be happy to take that if folks have availability. Also happy to work offline with schedules. I'm going to email the presentation out in a follow-up email, Kendall. So you will all get that. One of the things that we had talked about to kind of copy best practices, if you will, from other regions is potential to have a kickoff event conference convening with more than just this regional council, but other interested stakeholders that could also participate in the conversation that helps inform the 2-year plan that this group will ultimately adopt. So that's something that we can also connect with offline that would also determine scheduling, because it's possible that that might be the next step before holding this second formal regional council session. Awesome. I see a lot of exciting checkouts in the chat. No ideas on creative names like G-Rock, or I don't know, someone throw out Acorn for this group?
I don't work in marketing. I'm terrible at that.
Acorn, Adams County Opioid or Overdose Response Network. Is that what you're thinking?
I think someone had recommended that. Is that Ben? You were the one that maybe came up with that.
Yeah.
Ooh, Levon in the chat.
To add a little bit more color, the reason that Acorn was recommended because it grows into a tree.
Adams County, is it opioid or overdose? Probably overdose. Opioid, has to be opioid.
I mean, it kind of depends on what you think. Opioid, I would think, because it's specific.
Yeah, overdose freaks me out. But I have zero say here. I'm just listening.
All right. Well, everyone, you are free to hop off. Thank you for staying on a few extra minutes if you'd like to stay on. And if you have any questions, the Rocky Mountain Partnership team will hang on for a few minutes. Otherwise, thank you for being here.
So,
thank you so much, Jody.
Excellent. Acorn is the name for an international nonprofit, but I don't think there's a problem. But I think it's a good name.
We'll have our team do some thorough vetting to make sure anything that pops forward isn't going to get confused with anything else.
Okay, I do have to jump to other meetings, so thank you so much for doing this. I appreciate your help.
Thank you so much. Gabe, I see you're still on. Are you still with us? Hi.